It was a competitive, strategic move, building a larger organization. We committed that organization to patient care first and to making it a good place for employees to work. That was kind of the foundation to create what then became Prevea. Westside Clinic was predominantly specialists. Beaumont and Webster was predominantly primary care and OB.
So we merged 3 different clinics that became about 67 doctors.
We all kind of worked together. I mean, if we saw an area, I was in internal medicine, if we saw peds was busy, I'd run up there and help them out at the desk and until they got cleared, and I'd go back down to my main spot.
Everybody practices a little bit differently, so there was, a little bit of differences. Just getting together with the doctors and the other clinics and trying to work out where we wanted Prevea to be.
It was rapidly becoming a full-time job, being the CEO. So I stepped down, Bob Kafton took over.
My big thing was, I think that you don't look at the short-term gains. You look at what the long-term gains for the clinic, and we kept working with people to try to do things that would help the clinic grow. Built a new clinic right down in Webster, of course. I was part of that.
That was major because the old site was really small and
dumpy looking.
Yeah, well, the new place though was so much bigger and so much more patient friendly.
Initially, it was pediatrics, obstetrics, family practice, internal medicine, and the GI department. Well, we've expanded now to almost every discipline that there is.
When I first got my job 7 years ago, I think we as an organization realized we needed to grow to support not only ourselves but our hospital partners. So we were able to build a new attachment to Western Rec at the new Ashwaubenon site. We were able to build Pulaski. We were able to expand Howard, and I think we've done that 3 or 4 times in that time period.
Healthcare is always evolving. Healthcare is always changing. I think we're much more known in the community. We're much more involved in the community today than we were 20 years ago.
An example of that is when St. Nicholas Hospital, part of HSHS, asked us to come down and develop a multi-specialty group there. And last year, we decided to spread our wings even to the other side of the state, first in Chippewa Falls, now in the Eau Claire area, and definitely in the surrounding communities of Menominee, Arcadia, Osseo.
We've been doing the right things to be ready for the other changes that are happening in medicine in general. Our emphasis on quality, our emphasis on records, get us ready for the shift from just taking care of as many patients as you can take care of to actually taking care of patients in the best way possible.
I think the dedication, we will try to go out of the way to help patients. And I think that makes it very special.
What I think of being part of Prevea, the first word that comes to my mind is excellence. We're held accountable to high standards, and so our patients expect that.
My wife often asks, are you lucky to be in Prevea? And I say, yeah, we made a good choice initially, but it was more the people in Prevea that have taken it from where we were to now.
I can honestly say there is not a employee or physician that I worked with, when you work and you really do your best and you work with them, that they wouldn't do anything for you.
Even though we have grown so much, I think that, each area is still very close-knit with each other.
We share what's going on with our families, the good, the bad, the scary. We are a family. We truly are.
At the end of the day, I have my 4 children who are the most important thing in the world to me. But everybody that wears that Prevea name tag is family to me. Whether it be a courier, an orthopedic surgeon, a PSR, an MA, a rad tech, a med tech, everybody has added to this company in one way or the other.